Hey guys, welcome back to Medical Coding with Blue. Today is Christmas in July, day 7. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. For the next 25 days of this Christmas in July series, I am going to be sharing stories from my early days as a medical coder and some of my experiences. So I hope you all enjoy this very candid look at some of my stories, and I hope you enjoy. So let's get started. All right, today I am talking about the very first time I won back an audit. So I had been in my second position as a medical coder, working in a hospital, and this was the first time that I got a taste of what working in a hospital was really like, and discovering that you are not only audited by your supervisor, but you are also audited by a data quality team. At least that's the way it is at that facility. So for us, it was like, okay, we got through one audit and then we also had to survive another audit. So the thing about audits is it depends on the experience level of the auditor and what are some of the things that they see. Now, I can't actually recall the details of the audit that I won back. However, I do remember how I won my audit back. So this was a monthly audit. We would get audited monthly by our supervisor, and we would also get audited monthly by the data quality team, because they wanted to ensure that everything was coming through accurately, and if there needed to be any sort of supplemental education, that they were going to be able to be on hand to do that, or they were going to task it out to the supervisor to do. So I had done really well with my supervisor's audit, so I was like, okay, cool. Now it's just to survive this other one. And so as I'm sitting there talking with the data quality lady, and we all had to go individually to this meeting, and it was one-on-one, and this meeting was passionate. I will say that, because the auditor did not want to turn loose of the error. Now, I had an error on something. There was a code that got transposed or something like that. It was very minor. It was a minor thing. And then the error that I was trying to get back, because I was correct. And the way that I knew that I was correct was the book, number one. It was giving direction in the book. And not only that, there was a coding clinic on this audit. So I had a couple of days to look over my supposed errors, right? Because they tell you what records they've audited, and then they give you the auditor's recommendation. And so then you, if you agree, then you go with whatever the auditor said, and you can correct it and be on your way. If you disagree, that's when you have to set up a meeting and go in front of the auditor and explain your rationale. How did you come up with your answer? Or why did you select this code instead of the other code? So in looking at my audit, I was like, okay, that error that I messed up on, that I knew I did, I was like, okay, I can accept that one, and I'll correct that. Because that was just like I said, it was a minor twist of the code. So I was like, whatever. But there was this one that I knew I could get back. So I started looking in the book, and then I looked up the coding clinic and see if there was something related to this in coding clinic, and sure enough, there was. So I got that reference. I got where it's pinpointed to what coding clinic it is, and then I brought along my book. So I went to this meeting, and the auditor, she's a sweet lady. I've seen her at conference many times after this, and I didn't think she was going to recognize me because she hadn't seen me here recently. She hadn't seen me in a few years, and I heard her. She goes, Blue, is that you? And so I turned around. I was like, oh my gosh. And it was her. So she always remembers this meeting that she and I had, and she always says the same way that I do. It was very passionate, and she said, that's how I know that you're a good coder, because you got very passionate that day. And I said, yes, because I had to stand up and say, this wasn't this is the way, right? Because this is according to the book and according to Coding Clinic, and have all these other references. And, but for some reason this day, she just did not want to turn loose of the error and say, okay, yeah, you're right. She was insisting that she was correct. So as I'm trying to explain this, the more excited she's getting. The more excited she's getting, the more excited I'm getting, because energy sort of feeds off of each other, right? And when you start to try to defend yourself and somebody is defending their self, and there's not somebody in the middle to kind of say, hey, time out, you have to work it out with each other. How do you overcome this? Well, I didn't know. I wasn't as enlightened back then on, like the Arbinger Institute training, right? I didn't have that back then. So it was like, how do I convince her? How am I going to tell her that the way that I have my evidence is going to support this? So I finally got quiet enough to say, okay, the more I'm saying that I'm right, and the more that I'm trying to show her, the more she's resisting me. So if I let her say what she wants to say and get it out, there's a good chance that I'm going to be able to say what I need to say and get it out. And hopefully she'll hear me and be like, oh, and then the light bulb will go on. So again, I was being very idealistic, but it didn't work out that way. So I did let her finish her argument, and then I said my argument afterward, after we had our timeout, because we gave each other timeout. Like, okay, let's just talk this out, because we were trying, but she was so steadfast in the way that she had saw this error. And so she said, well, I think we're going to have to bring somebody else in, because I don't see it the way that you do. Even though you're showing me this, I'm still not seeing it your way. And so I said, okay. So we had the person above her come in and break the tie. And of course she agreed with me, because she said, Coding Clinic's right there and it says it. She's like, and so she's like, we find in your favor. So I was like, okay, cool, And so I just corrected what I needed to, and that was it on the other one. But this taught me a very valuable lesson, that when you are, the energy that you put out is energy that you're going to get back. Obviously, I was defending myself because I really wanted to get this back. This was an error that was not an error, right? And I wanted to be as accurate as possible. And it's not that there was any monetary gain for me, because it was more like, okay, you need to keep your accuracy up, because we need to know that we made a good choice with you. And so that's where I was. And plus, remember, I'm far away from home. And I'm like, okay, I need to keep my job, so I need to have really good accuracy. And we were on accuracy standards. They weren't as high as they are here. I think it was like 93%. But I still wanted to be above that, because, again, it's what you do. So I went back to my supervisor and I told her what happened. She's like, oh my goodness. She's, well, good for you. She's like, I'm glad that you went and you had your evidence with you. She said, that is a problem a lot of times with coders, is that they don't bring their evidence. And I'm like, holding all these books, I'm like, you have to have evidence. You can't just say. And she's like, well, believe it or not, sometimes people are just so willing to say, okay, this person has experience, I must not know what I'm doing, let me just agree with them. And she said, clearly, you didn't do that, because you knew that you had the correct answer. She goes, but I'm glad they found in your favor, and I'm glad that, it worked out in the end. And I'm like, yes, me too. And so ever since then, after that, I knew, okay, I have to make sure that I always have my resources. So when you are getting audited and you are going up against people who have degrees, sometimes you're going up against people who have years of experience or perhaps a higher credential than you, you want to make sure that you still are able to support your argument in yourself. Even though they have all the education, or even though they have those higher credentials, it doesn't mean they know everything. And it should never get to a point where, you know, any tempers flare. This was just a passionate argument. This was not a argument, you know, like a bad argument. It was just a passionate discussion, right? I should say. And because she thought that, okay, I have all these years of experience, I should be correct. And it wasn't the case, you know. I actually got it back, you know. So after that, you know, going in after with all of my materials, and always knowing that I need to support myself when I'm selecting these codes, always gives me a really good idea of like, okay, this is what I'm going to be up against. And the harder the charts that you have, the more your memory gets a little bit sharper, because there's something unforgettable about your charts and your encounters that you go through, because you're reading them all day, right? And it's easy for you to recall. Sometimes it's not always going to be easy for you to recall what you were thinking, but it is going to get easier with time, and you're going to be able to realize what I mean when I say, hey, I know I've read this, or yeah, when I was reading that, I was thinking this. And that will help you in your argument, because then you'll sort of have that frame of mind, like, okay, this is what I was thinking when I did this. But it's funny when you start to recall things, and then you think, did I read this? Did I code this already? But it's just part of the thing when you are a medical coder. You will start learning these little weird things. Probably one of my most favorite memes that I see about medical coders is the one that is the peacock. You know, when you tell a coder that they're wrong, their feathers go up. Exactly what a peacock does. That's true. But anyway, I'm going to go ahead and wrap this one up. Thank you guys for joining me on this trip down memory lane, talking about these audits. And I will see y'all on the next episode. So please like, subscribe, share if this helped you or if you enjoyed it. And I will see y'all for tomorrow's Christmas in July. Bye.